Hi, I'm Dr. Deidre McDonald, and I wanted to chat with you a bit today about endometriosis. This is an area where naturopathic physicians can play a very important role for women. Endometriosis is a condition that can cause incredible pain, both with menstruation and throughout the month. And it can also create infertility in about a third of the patients. So for this condition, patients are often told that their only resort is to have a hysterectomy or to have repeated laparoscopies where those lesions are zapped. They might have to go on the pill or take other hormone treatments. But none of those treatments are really designed to enhance fertility, and none of them are really getting at the underlying cause of the problem. So this is where naturopathic medicine comes in. We look at the physiology of what's actually going on. What are the mechanisms that drive endometriosis? And how can we work at helping the body to correct those underlying problems? Turns out what actually causes endometriosis, we think now, is that uterine tissue, instead of flowing down, as it typically does with menstruation, it flows up and out the fallopian tubes and into the uterine cavity. So you have bits of uterine tissue floating around the abdominal cavity, and that tissue can adhere to the bowel, to the bladder, to the ovaries, and other tissues. Now, that tissue is still sensitive to hormones, so it develops fluid and blood and kind of menstruates into the abdominal cavity. So this is where the pain comes in. It's extremely painful. Now, it turns out it's not unusual for women to have uterine tissue come out the fallopian tubes, but the immune system usually goes after it. It gobbles it up. It recognizes that this is tissue that needs to be destroyed. However, in endometriosis, the immune system goes awry. It ignores those tissues, lets them proliferate. So why is that? Why doesn't the immune system notice that those tissues are out of place and kill them? Well, it turns out they're just responding to a set of conditions that sets the immune system up for this. And those conditions are, first and foremost, a hormone imbalance called estrogen dominance. Estrogen dominance is when you have more estrogen and not enough progesterone to balance it out. And this can be caused from a combination of genetic factors, environmental factors, and lifestyle factors. So the first thing we do as naturopathic physicians is use lifestyle and natural medicine to help correct that imbalance. We work at helping the body eliminate estrogen. We work at helping the body produce more progesterone so that you can create a better hormonal milieu. Those hormones then can let the immune system do what it should do. It also turns out that people with endometriosis have more inflammation in their abdominal cavity. They have more oxidative stress. So we use natural medicines and lifestyle practices that address those two mechanisms. So you can see how we're starting to build a program that actually treats the underlying cause. And when we do that, studies have proven that women have less pain and their fertility is enhanced. So I hope you can see that endometriosis is not a lifelong sentence of chronic pain. It's something that can be addressed if we use the right strategy to get at the underlying cause.